Eye examination. The important area of examination are visual acuity, visual fields, conjunctiva and sclera, cornea, lens and pupils, extraocular movements, fungi including optic disc and cup, retina and retinal vessels.
Hi, I'm Robi William. I'm MD second year student. May I know your name and your age, please?
Hi, I am Rohan and I am 20 years old.
Hello, Rohan. Today we are going to examine your eyes and test your vision. Is that okay for you?
Okay, sir.
Okay, thank you. So those are the glasses that you normally use to see the distance with. Am I right?
Yes.
You can keep that on for me. Okay, thank you.
Begin the eye examination by assessing the patient's visual acuity. Have the patient stand 20 feet from the Snellen's eye chart. Patient using contact lenses or glasses should wear them. However, patient should remove their reading glasses.
What I like you to do is hold this chart before your left eye, right, and see the chart and read the smallest line possible for you.
Okay, sir. 4, 2, 8, 3, 5, 6.
Oh, very good, very good.
Repeat the test on the other eye. Visual fields are tested by confrontation, which is a valuable technique for early detection of lesions in the anterior and the posterior visual pathway. In the static finger wiggle test, face the patient directly and imagine a glass bowl encircling his head with the base of the bowl facing me.
Look directly into my eyes with both of your eyes, and now tell which when does you see these wiggling fingers?
Yes, sir.
Okay.
S. 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 S.
Okay.
If we find a visual defect, trying to establish the boundary by testing one eye at a time. Repeating this at several levels until defining the border of the defect. Then testing the other eye for the accompanying defect. In kinetic red target test, moving a red topped pin inward from beyond the boundary of each quadrant. Asking the patient when the pin first appears to be red. Facially, inspect the patient's eye for position and alignment. Examine the eyebrows and closely inspect the eyelids for the width of the palpebral fissures, edema and color of the lids, any lesions, and the condition and direction of the eyelashes, noting the adequacy of the eyelid closure. Inspect the area over the lacrimal gland for swelling and looking for excessive tearing or dryness. Asking the patient to look up for inspecting the patient's sclera and conjunctiva, looking for any nodular and swelling and color. In oblique lighting, inspecting each cornea and lens for opacities. Shining the pen light from side towards the eye and inspecting each iris. Testing pupillary reactions to light. First, darken the room, then asking the patient to look into a distant object. Shining and bright light obliquely into each pupil, looking for a direct reaction consisting of a pupillary constriction, swinging the light quickly to the other eye, looking for consensual reaction, assessing the ocular alignment arising from the extraocular muscles, shining a light directly in front of a patient in the distance of 2 feet, inspecting the reflections in the cornea, should be visible slightly nasal to the center of the pupil. Assessing the extraocular movements, looking for a conjugate movement or a deviation from normal, nystagmus or lid lag. Asking the patient to follow my finger as I am sweeping through the 6 cardinal directions of gaze, making a wide H in the air, leading the patient's gaze to the right, right and upward, down on the right, then without pausing up to the extreme left, then upward, then downward. Next, after darkening the room, conducting the ophthalmoscopic examination, switching on the ophthalmoscope and adjusting the large white beam of light, setting at 0 diopter, asking the patient to look over the shoulder at the specific part of the wall, shifting the light beam on the pupil, making sure to clearly see the aperture, placing the thumb of the other hand in the patient's eyebrow and locating the red reflex, moving in with the ophthalmoscope by holding the red reflex, locating the yellowish orange structure that is the optic disc, noting the color of the optic disc and size of the physiologic cup, looking for papilledema, which is the swelling of the optic disc, examining the fovea and surrounding macula and the arteries and the veins. To focus on more anterior structure such as opacities in the vitreous body or the lens, changing the diopter to more positive numbers. Repeat the ophthalmoscopy examination on the patient's other eye.
To summarize, I made an eye examination to Mr. Ruhan, who is 20 years old. He has a normal ear side and no abnormalities. Thank you. Okay, now we will be examining your ear. Is that okay for you?
Fine.
Okay, thank you.
Beginning by inspecting the auricle and surrounding tissues for deformities, lumps, or skin lesions. See if there is any pain, inflammation, or discharge is present. Doing the tuck test. Move the auricle up and down. Press the tragus and press firmly on the mastoid bone behind the ear. Tenderness here suggests mastoiditis. Examining the ear canal and eardrum using an otoscope. Inserting the correct speculum gently into the ear canal, directed it forward and downward. Noting for cerumen or earwax. Noting for discharge, foreign bodies, redness of the skin or swelling. Seeing the pars flaccida and pars tensa. Examining the other ear in the same manner. If the patient reports hearing loss, proceed to the whisper voice test.
Okay, Rohan, we are going to start with a simple ear test, which includes I will stand behind your back and I will tell three numbers, random numbers in each ear, and you should repeat me back which numbers which I say. Is it okay for you?
Okay, sir.
Okay, thank you.
531 423 891 321 461 789.
For the patient failing the whispered voice test, a tuning fork test helps to determine if the hearing loss is conductive or neurosensory in origin. In a quiet room, I am selecting a tuning fork of 512 Hz, setting the fork into light vibration and testing for lateralization by performing the Weber test.
It's the same in both ears.
Okay.
Comparing air and bone conduction by performing a Rene test. Placing the lightly vibrating tuning fork on the mastoid bone level with the canal. When the patient indication that the sound is no longer heard, quickly placing the vibrating fork near the ear canal and asking if the sound can be heard. The U of the fork should be faced forward. Make sure to test both the ears.
Okay, that's the end of the examination. Do you have any questions?
No.
Okay, thank you.
Thank you.
Today, I made an ear examination on Rohan, who is a 20-year-old male. On inspection, I don't find any abnormalities. On hearing, it was a normal hearing. I don't find any problems. On tuning for test, there was no problems at all. This was a normal ear examination. Thank you.